Hey, Dan here. It's almost that time of year when employers tell their workers what's on tap for their health insurance in 2026, which doctors are in, which drugs are out, and how much it's going to eat out of their paychecks every month. But what if, instead of making those tough calls behind closed doors, companies opened up those doors and invited employees to weigh in? That's the unusual approach taken by one company we profiled back in 2024. This week, as healthcare costs continue to climb, we revisit that story. Health insurance premiums eat up nearly 20% of every employee's paycheck in the U.S. on average, and those costs continue to climb. There's an avalanche of reasons: higher hospital bills, expensive scans, pricey new drugs for cancer or weight loss. These costs force companies to make tough choices about what benefits to include in their health plan and which to leave out. Executives usually do the deciding, but an employer in Maryland thinks that there is a better way.
We're not the kind of place where one person sits by themselves and makes decisions that impact a lot of people.
Today, employees, not executives, design their organization's health plan. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. Summer, if you're lucky, is the season for vacations, pools, and barbecues. For the staff of the American Speech Language Hearing Association, or ASHA, it's also the time to play a game called Benefit Builder. Over the last few months, 140 employees, about half of the staff of this association in Rockville, Maryland, divided up and played in small groups. They stepped away from their regular work to spend a few hours debating how to spend the organization's healthcare dollars.
I didn't expect I was going to have fun designing our health insurance plan.
That's 40-year-old Evan Reid, head of analytics at ASHA. On this particular Monday morning in July, Evan and 7 coworkers spend a little time on their own, creating the perfect health plan for themselves and their families. Evan has 2 young kids. For him, good insurance means dental care and low out-of-pocket costs for doctor's visits or tests. His colleague, Jeanette Janota, a senior research associate, wants something different.
I'm elderly, I need health care, and I'm willing to pay for it.
Jeanette's 82 and would like cutting-edge medicines if she needs them, plus a wide choice of doctors and hospitals.
I have a dermatologist, an obstetrician, gynecologist, a cardiologist, an orthopedist, you name it, and I've got it.
Once everyone designs their dream plan, they turn their attention to their colleagues. Each player picks a card to read out loud, hypothetical scenarios based on new benefits that ASHA is actually considering. Julia Reilly-Edwards, another data scientist, reads hers.
I have pancreatic cancer. I have not responded well to treatments, and the prognosis is grim. My doctor said it wouldn't hurt to try a drug that's only been approved for bowel cancers. It costs $8,000 a month and would only be covered with the highest level prescription benefit. I know it's not a cure, but I'm hoping it may give me a few more months with my loved ones.
The question here is, do you personally want to pay higher premiums every month so that a coworker could get access to what could be life-extending care if they needed it? It's just one of several dilemmas the group thinks through together as they enter the next phase of the game. To ratchet up the stakes, Janet McNichol, ASHA's head of human resources, directs the group to another part of the room and hands out 70 poker chips.
All right, so what we're going to do next is gather around the large game board over here.
Janet created the game board, where coverage for things like surgery, prescription drugs, and mental health each costs a certain number of chips. The more generous the coverage, the more poker chips that option costs. Here's where it gets tough. The group must come to a consensus on where to spend the chips.
If you were to buy the whole health plan, it costs 92 chips. You have 70 chips. So you're going to have to do a little bit of prioritizing. What services and features do you want, and what are you willing to give up for that?
Janet says this is the most important part of the game, the most realistic. ASHA designs its own health plan rather than buying an off-the-shelf policy from an insurer, And Janet faced these decisions for years on her own. Back when she first got into the business in the 1990s, she says she was comfortable making choices when health benefits seemed more straightforward.
We're like, are we going to cover birth control? And I'm like, yeah, 80% of our population is women. We want them at work, so of course we will. Are we going to cover Rogaine? Hair, not necessary. We don't need to cover Rogaine. Like, the decisions weren't that difficult.
But over the last 30 years, many new tests and treatments have emerged, and healthcare spending has tripled. That squeeze has put Janet and other benefit leaders in a tight spot. ASHA's healthcare budget for 2025 is about $4 million. Janet explained that covering every option on the board would take another $1 million plus.
Obviously, you have to make trade-offs. You can't pay for everything because it is really expensive.
Things came to a head for Janet in 2016. She was sitting in a room with an insurance agent who was firing questions at her. How much physical therapy do you want to cover? When do you want to cover an MRI? As she weighed each question, Janet pictured paychecks shrinking. And it wasn't just the expense. Healthcare was becoming more controversial. What about gender-affirming care? What about abortions?
We're making all these decisions and we get to that one, and I was just like, whoa. I'm almost like didn't want that responsibility for making that decision for everybody else.
Janet wanted to know what her employees wanted. What healthcare did they most value?
That was a moment where I was thought, there's got to be a better way to do this.
Most companies would just email a survey, but Janet wanted to go deeper, to get workers to really grapple with the limits she faces devising the company plan.
I'm looking for people to have a dialogue and weigh the trade-offs between one choice and another choice, and then you're able to come to some sort of consensus that everybody accepts and feels good about.
Turns out there was some science behind Janet's instinct. Research shows that when employees or patients are included in decision-making, they tend to be happier with the final outcome.
When you're making value-laden decisions, how you decide matters.
Now, Janet loves the nitty-gritty of healthcare economics. She actually discovered this game when she was taking a health econ class a few years back. Scientists at the University of Michigan and the National Institutes of Health had created the game in the 1990s. The game was simple to play, no jargon or background in insurance required. She thought it could be a very good fit for ASHA.
People here care about one another. They're kind. We team up on a lot of things. People work together routinely. So I do think it fits with our culture.
Janet has asked workers to play the game twice over the last 8 years. One of this year's toughest questions, whether ASHA's health plan should cover drugs like Wegovy for weight loss. Tavril St. Jean, a senior research associate, picks up a game card and begins to read.
I weigh about 300 pounds. I am pre-diabetic and at risk for heart disease. I've tried restricting food, but I always feel hungry. My doctor suggested I try Wegovy. It costs $1,400 a month and will only...
Jeanette Janota likes the idea.
Personally, I wanted to have that option.
Evan Reid, the guy across the table from her, he isn't so sure because, remember, the team has only 70 chips to spread around the whole board.
But the question is, do you need that coverage for the entire 300-person staff at the cost of 6 chips?
Evan's kids are 6 and 11. He'd rather spend some of the money on their braces.
Chips. I still very much want to make an argument for orthodontic care, which is going to be a large out-of-pocket expense for a decent chunk of staff.
These debates are exactly what Janet wants to happen. It's the first step to finding a compromise. After the break, what benefits the group picks and whether this game might work for other employers. Welcome back. Before the break, we heard about how one employer is using a game to help employees design their own health plan. Tradeoffs reporter Alex Olgin found this story and joins me to talk about it. Alex, first of all, how did you even hear about this? Like ASHA turning over these decisions to their employees, let alone through a game?
Yeah, so Dan, I was doing research on an issue that employers struggle with. Are they going to cover these new weight loss drugs like Ozempic or Wegovy? And as we've reported before, drugs in this class, known as GLP-1s, are hugely expensive and a key reason why healthcare spending has shot up. And that's led some employers to drop coverage of the drugs altogether, leaving workers who are already on the medicines in a really tough spot.
North Carolina's state employees will no longer receive reimbursement for GLP-1 agonists like Wegovy and Zepbound.
But now the University of Texas system says it will end insurance coverage for Wegovy.
The problem is that employees can suffer when companies make these sudden cost-cutting choices. So what ASHA is doing, Dan, is flipping the script and giving workers more of the power. Basically, they use the game to ask this question. Do you guys want to pay more in premiums every single month so that any of your coworkers who want these expensive new weight loss drugs can get them?
Right. So, Alex, I know we talked about this in the first half of the show. What did that group of 8 ASHA workers decide about Wegovy?
So it was interesting. The employees basically said no, they were not willing to pay more to cover the drug, nor were they willing to cover it at the expense of cutting coverage in other areas like mental health or hospital care.
And I'm curious, did these folks agree fairly easily on other benefits?
Some stuff, yes. The team quickly settled on paying for the most generous emergency care, primary care, mental health, and dental, including braces.
I can picture Evan's face with a huge smile plastered on it.
Yes, he was grinning ear to ear. And as you know, Dan, I'm married to a dentist who was also pretty happy to hear that as well.
Okay, but a risk of this game, I must imagine, is that employees could get mad or defensive when they disagree. Did that happen? Were there any fights here?
No fist fights, but there was a pretty contentious debate in this group for almost an hour about doctors and hospitals. And Janet would say, that's great. She loves these disagreements. They're just the kind of healthy clashes she wants her people to have about their health insurance. It's a sign that she thinks the game is working. The important thing is how employees resolve those conflicts.
Right. So you said there was a conflict about hospitals. What was that about?
Basically, some employees like Evan thought initially it would be best to go with a plan that made it cheaper to go to hospitals with higher safety marks. But Jeanette disagreed. Over the last few years, she's had both of her shoulders replaced.
You have regular surgery kind of stuff like a replacement for a shoulder. You find your doctor and you go where that doctor goes to his hospital. You can't pick your hospital.
Listening to Jeanette's experience had a big effect on Evan. It changed his mind. Here's what he told me after the game.
I think Jeanette probably had some of the most poignant examples of where what we thought was an ideal policy from a healthcare standpoint just didn't really meet the real world well.
Getting people to change their minds is big. I mean, I can see that as a real strength of this game. But practically speaking, Alex, the group has a limited number of chips. How can they afford everything that they're saying yes to?
You're right. With 70 chips, they can't. They wrestled with that for more than an hour. And ultimately, they decided it was so important to the group to be able to go to any hospital that they did something Janet's never seen before. They agreed to forfeit a bigger chunk of their salary to buy more chips. Here's how that discussion went.
I propose we buy 4 tokens for hospitalization and surgery.
How much is that again?
So $800 on the year.
Per person.
Yeah,
$16 a week per person. I would be okay with that.
That's the sound of Janet McNichol plunking down 4 more poker chips. Now, Janet's run a dozen more rounds of the game this summer with various groups of employees.
I've never seen a group that bought that many chips before, because they bought 4. Highly unusual.
Wow. So faced with the limits and disagreements, their compromise was forking over more money from their paychecks. That's got to be peak game.
It definitely is. Now, Janet would tell you that it was grappling with the decisions together that was key. It's just one of the things that she really likes about this game. Now, the last time she ran it was in 2017, and 85% of employees told her they liked the result. They were happy with the overall group decision. She's found that across the company, when employees have this kind of direct input into the health plan, they're more willing to accept limitations or even higher costs.
That sounds pretty consistent with the research that we talked about already, Alex. This game seems like it can help employers figure out a way to design plans that get more worker buy-in. This at a time, of course, when you've got the weight loss drugs forcing employers to think long and hard about what to do. Are other companies using this as a tool?
I've asked around, and I've only heard of a local government and a school district using it for this exact purpose. To find out why, I called Paul Fronstin. He's a health economist at the Employee Benefits Research Institute. And he says there are just much easier ways to get employee feedback.
For instance, some employers do surveys. Some employers will do focus groups. It is rare for an employer to go to this length.
I get it. I mean, just to start, it takes several hours of every employee's time to do it. That's time that they're not on their jobs. And it's also probably a ton of work for people in human resources, people like Janet.
Yeah, starting in January, Janet has to figure out what questions she's going to ask employees. And then she has to do the math about how much each benefit would cost, and then more math about how much each chip is worth. After running different rounds of the game all summer, she then tallies the results from all the groups.
Super time consuming. Is that the big downside of this game?
It's not the only one. I mean, employers have to be willing to give up some control to their employees, and that could be tough. And every game could just be opening up a can of worms, inviting conflict between workers. And that's why, Dan, one of the ground rules is that workers must come to a consensus, which means they're forced to listen and horse trade.
Oh, okay. So after all of this compromising, Alex, from this group and employees in the other groups, what's the final outcome for the health plan?
By and large, there was consensus among the groups, even on the thorniest of questions. They all decided not to cover Wegovy, but to cover abortion and infertility treatments. However, on that big question about hospital choice that Evan and Jeanette's group spent so much time debating, where they decided to buy extra chips, workers overall decided on something different. They chose the option that makes care cheaper at hospitals with higher safety marks. So that's how Janet will structure the final plan.
What did Janet think about how all this turned out?
Here's what she told me.
I can sleep at night because I'm not making these value-laden decisions for everybody else.
She says for her, in the end, the details of the plan are less important. What matters a lot more are the honest conversations about healthcare and the way the game helped people empathize with their colleagues. It really boosts morale. 27-year-old Julia Reilly-Edwards was in Jeanette and Evan's group, and she told me that the game helped her understand people who've had different healthcare experiences across generations.
I thought just the overall ability of the group to have a really personal kind of discussion about it, but one where we were open to listening to each other, I thought was really refreshing and very important.
This is the kind of thing that gives me hope for the world.
That's Janet, of course. And she says that sentiment from Julia is why the game is worth all the trouble.
Like, people can make these decisions together. And if you build a process for dialogue, then people can engage and they can think deeply about things and they can change their mind or see things from a different perspective. And I think they can generally come to agreement on things.
A life lesson that goes far beyond health insurance, Alex, clearly. Thanks for your reporting on this.
You're welcome, Dan.
So, this year's game is done, but Janet is already thinking about the next version. At the top of that list is another fertility benefit. Should ASHA pay for employees who want to freeze their eggs? Right now, about 20% of companies pay for the procedure and egg storage. But every appealing new benefit comes at a cost, as the game makes plainly clear. Since this episode first aired, employers' health costs showed no signs of slowing. Analysts expect spending to rise by 8% next year. As for Janet McNichol, she says as far as she's heard, employees are happy with the choices they made. And perhaps more important to her, they're happy with the process. A recent survey that Janet ran found that more than 80% of employees said they feel that the organization values their views on their health benefits. In her spare time, Janet says she's working on a how-to guide for other employers. I'm Dan Gorenstein. This is Tradeoffs. Making healthcare prices public was one of the most significant and lasting health policies from the first Trump administration. But the hope that transparency would turn us into smart shoppers, well, it's a dream still out of reach. Next week on Tradeoffs, why price transparency so far has fallen short. And an update on where the president is plowing ahead with public prices now that he's back in office.
Thanks for listening to Tradeoffs. If you've just discovered us, remember to subscribe to the feed so you never miss an episode. Subscribing is free and easy on whichever podcasting app you use. The NPR app, Apple Podcasts, Spotify, wherever you listen to podcasts. The Tradeoffs team is producers Alex Olgin and Ryan Levy, editor Deborah Franklin, executive director Jessica Silverman, marketing director Catherine Dougal, audience engagement lead Shannon Crane, with help from Kate Seepy and Cedric Wilson, sound designer Andrew Perella, executive editor Dan Gorenstein, and senior producer Leslie Walker. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Tradeoffs coverage of healthcare costs is supported in part by Arnold Ventures and West Health. Additional thanks to Susan Gould, Samia Hurst, and Joanna Broder. Thanks also to all our listeners who helped to support our work, including Nate Apathy, Jody Totten, Tara Ragone, John Liu, and Nicole DeStasio. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Leonard Davis Institute at the University of Pennsylvania, and the National Institute for Healthcare Management Foundation. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.